How should I introduce myself in a PLAB 2 case? I get this question asked a lot. I'm Dr. Arora from Arora Medical Education, and I do a lot of role play practice, and we do a lot of mocks of people doing PLAB 2. And a question I get asked really commonly, and it's one of those questions that I think really is an example of one of those questions that people ask or think about too much, or worry about too much, or doubt about too much, or get loads of advice on, is what is the right way to introduce myself, or how do I start a case? So in this video, I'm going to talk about two key things, okay, about the introduction. Number one, what is the right way to introduce yourself and how not to think about that. And number two, whether you talk about a person's first names or whether you should say Mr. X or Mrs. X. We're going to cover both of these in this video, and hopefully if these are questions that you are thinking about or you've been told lots of things about, hopefully this video is going to be of some value. Now, one thing I would say is the whole point of the beginning of a PLAB 2 scenario is that you know who the person's in front of you and they know who you are. And there are many, many, many different ways of doing this. And you guys will have introduced yourself to patients in your life thousands of times, okay? So you have your own way of doing it. Yes, you need to make sure that you've done certain things to demonstrate that I'm safe and I know I'm able to understand and realize when this is not the right person. But there is no right or wrong phrase. So for example, I see a lot of people just sending out robotic phrases that you can tell they've just basically learned or been told to say for the PLAB 2 exam. Hi, I'm Dr. So-and-so, and is it, can I ask your name or confirm your name? And can I ask how you would like to be called? Like, these are things that, it's obvious that it's just been learned and it doesn't sound great and it doesn't give a good first impression. It doesn't set the right tone. It looks like I'm being a robot and I just have to do these things. Be natural. Hi, I'm Dr. Aman. Hi, is it Mrs. Jakes? Great. How can I help? Just a really simple introduction. They know who I am. I'm confirming that it's the right person. I'm not asking how do you prefer to be called or how do you prefer that I call you. I'm not asking for permission for anything, or do you mind if I confirm your name? Just go in and be natural, okay? Because the most important thing from an interpersonal point of view is that the person that you're role playing with thinks that you are natural, because the moment that you seem calm and you seem that you've done it 100 times and that you seem that you're genuine, the moment that happens, the connection happens, the rapport happens, they become that kind of bridge is built between you guys to allow you to have a decent conversation. If you go in and it looks very clinical, methodical, pre-learned, structured, let me just get these phrases out first, let me just confirm how do you want me to call you, then the bar is set that this is going to be a bit of an awkward situation, because it's going to be a little bit robotic and a bit kind of forced and preempt and pre-learned and pre-tailored and all those things that I'm often telling people to try and reduce when it comes to PLAB 2 consultations. And in addition to this, the other thing that's really important when it comes to introduction is don't worry about if you're going to say, is it Mrs. X or is it Julie? Like, don't overthink this, okay? Don't think that, I have to say Mr. or Mrs. or I can't say the first name because it's not right. Go with your gut feeling, okay? You have introduced yourself to patients your whole career. There are some patients where you will say Mr. and Mrs. and there are some patients where you'll say the first name. There are some, maybe you're the kind of doctor who always does one way or always does the other way. Like, it is completely fine. Don't think that you have to say a certain thing like, I can't say James because it doesn't look respectful or I'm not allowed to do it. Just say what seems right for you, because if you do something else to what you normally do, trust me, it's going to sound really odd. So for example, you could say, hi, my name is Dr. Aman, I'm a junior doctor on the ward. Is it Mrs. Jackson? Okay, great, thank you. How can I help? Or you could say, hi, I'm Dr. Aman, I'm one of the junior doctors on the ward today. Can I just check, is it Jessica? Great, how can I help? See, both are completely fine. Like, don't feel like, you get marked up for one and marked down for the other. You've just got to sound natural. Now, obviously, if you see someone who is slightly younger, you might just say the first name and be fine with it if they're kind of on your age level or maybe just a little bit older. But if you see someone who's, 80s, 90s, and you feel like you want to say Mr. X, that's fine. But your gut feeling will tell you that. You will see that patient and your gut feeling will tell you that it's right to say Mr. or Mrs. or go by first name. Don't go with the pre-learnt idea that you must say it like this. That's what I'm trying to get across, okay? There are so many ways of introducing yourself to somebody. There are so many ways to open up a consultation, but don't go with the pre-learnt focused way that you're going to do every single time. Trust your gut, trust your instinct. One of the things that we talk a lot about in PLAB 2 is the importance of trusting your own instinct and your own gut feeling, and being confident that when that situation comes up, I'll know what to say, and I don't need to clutter my mind with a whole bunch of stuff that I should be saying. Because I tell you what, there are so many more things that your mind should be filled up with in terms of PLAB 2. These things are just wasting your time, wasting your energy, and wasting your focus as to what could be something else that is really important in that particular case. So if you have doubts about this, and if you've been preparing for a particular introduction, and if you have had conflicting pieces of advice, this is the right phrase, this is not the right phrase, you should do this, you shouldn't do this, please take this video as a bit of a simplification. Okay, a lot of PLAB 2 is simplification. I spend a lot of my time teaching, whether it's in our mocks or one-to-ones or live cases or our online courses, audio courses, whatever it is that you guys might be using. You'll know that we simplify PLAB 2, that the whole point of this exam is to keep it simple, demonstrate your skills. Don't go in and show a whole bunch of lines that you think that you've learned that get you marks. It doesn't work like that. It's about being confident. It's about approaching a situation and demonstrating that I know what I'm doing, I'm fine, I'm relaxed, I've done this 1,000 times, I know how to assess a situation, I know how to talk to a patient. And that starts with the way that you introduce yourself. And if you introduce yourself in a way that looks awkward, odd, pre-planned, pre-learned, and not something that you do every single day in your career, then it is not going to give the best first impression. And remember, first impressions are for two people, yeah? It's not just for the role player. Of course, the first impression of the role player is important, so they gel with you and they can then help you in the case and have a conversation. But of course, it's also for the assessor. And if the assessor thinks that you're saying something that is not normal for you, or that you're kind of doing something just because someone's told you, then already in their mind they're thinking that this may end up being another kind of structured robotic consultation that we see so often when it comes to practice in PLAB 2. I really hope this video is of some value. If you are studying for PLAB 2 and you want 10% off any of our courses, resources, mocks, online audio, whatever it might be, please use the coupon Arora Video 10, ARORAVIDEO10. If you're new to the channel on YouTube and you found this video of some use, please do subscribe to the channel. Please do like and comment on this video, and hopefully you'll be getting more pop up in front of you to try and help you through your PLAB 2 exam. But please, please, please remember, introductions don't have to be pre-rehearsed. You just need to be confident and relaxed. Hi, I'm Dr. Amin. Hi, is it Mrs. Jakes? How can I help? So I really hope this video has been of some value. If you want loads more PLAB 2 videos, please do stick around on the channel. Listen, have an amazing day. Hashtag Campus will pass. Hashtag I went with Arora. Take care.